Yeah.
Today we have Dr Beaumont with us, and he is going to answer some questions about cannabis.
Hello, I'm Dr Beaumont. I'm a general practitioner in Dumfries. I'm also one of the local police surgeons here, and I also do a drugs clinic to help the drug centre here as well. So, hello.
So is it true that cannabis makes you paranoid? And if it does, why?
Well, the general feeling is that the answer to that question is yes, cannabis can make you paranoid. Now, cannabis contains a drug that we all know as THC, and that stands for a fancy name which I won't mention. But this binds to brain receptors in the brain, and it affects a chemical called dopamine. And this chemical called dopamine has an effect on the way you think, the way you perceive emotions, and things like that. So, smoking cannabis can affect the brain, affects your thought processes, and paranoia basically means that you think people are talking about you, they think people are against you, and that can range from quite mild cases to quite severe cases. You have this fixed idea that someone's out to get you, and that can be part of a mental disorder. So the answer is yes, it does. It can make people paranoid.
Is it true that cannabis can make you depressed? And the same if it does, why?
Well, again, the reason why is again because it's a drug and it affects parts of the brain receptors that affect this chemical dopamine. But in general, the feeling is it does affect your mood, it can affect the way you think, and it does make you depressed. And it gives you this, especially if you've been using it for many, many months or years, everyone has this perception if you take it, it makes you feel great, it makes you feel euphoric and relaxed. But after you've been using it for a long time, for many months, it can make you very emotionless, it can make you withdrawn, it makes you not want to do anything, makes you want to just sit about. And it causes this, it's called an amotivational state. You just sit there, smoking away, and not really enjoying anything, and that can affect your mood. And in this state, people can get depressed. And there is evidence, studies show that if you're a long-term cannabis user and you're depressed, it can increase the risk of suicide as well.
Alright, thank you.
Okay.
Is a 16-year-old more likely to get mental health problems from smoking cannabis than a 26-year-old?
The answer to that is yes. The younger you are when you smoke cannabis, the more likely there is a chance that you will develop mental illness and associated what we call psychosis. And this is very important because the younger you are, obviously your brain's in a very developmental stage, and the implications for the future are quite big, because if you have problems when you're young, and smoke cannabis when you're young, in your early teens, it's going to increase problems for later life, and that's not good.
What is psychosis?
Psychosis. Psychosis is a mental disorder where a person's emotions are affected, a person's general interactions and daily function in life are affected. They can't deal with normal things. Their speech is affected, they can't do things. And it's usually characterised by a collection of symptoms where people get delusions and hallucinations. Hallucinations, I think we all know what those are, where people have this perception that they can hear things, they can see things, and things like that. It's a disorder of a sensory perception, and it's very real to these people. It's not just that you don't imagine it, that you really think they can hear things and see things. A delusion is where someone has this fixed idea about something. They think people are talking to them through the radio. They think messages have been sent into the house by the next door neighbour. And all these collection of symptoms form a psychosis. And this psychosis can happen when you smoke cannabis. The longer you smoke cannabis and the increased amount that you smoke, the strength of it is very important, the more chance you can develop psychosis. Okay? And they say about 10% of cases of psychosis can be caused by cannabis. It's also, you get psychosis in other mental illnesses like schizophrenia, depression, you can get psychosis. When you've had a baby, some women can become unwell and they can get a psychosis postnatally. And also people with dementia. So it's not just in people who smoke drugs. You can get it with other illnesses and mental illness as well.
What is schizophrenia?
Right. schizophrenia is a mental illness as opposed to a mental disorder, and the symptoms are very similar to that of psychosis in that you can get delusions and hallucinations, and these are what we call positive symptoms. You can also in schizophrenia get what we call negative symptoms, where someone becomes very withdrawn, lacking emotion, they just want to sit about, do nothing, they don't look after themselves, they're not bothered about going out, keeping tidy, keeping the house tidy. And so schizophrenia is not an easy thing to diagnose. It's not just diagnose, you see someone diagnosed, it's diagnosed often over time. And often you have to have at least 6 months of these sort of symptoms, and within that 6 months, at least another month of these persisting psychotic type symptoms. So it's a diagnosis usually made by psychiatrists after looking at someone over several months or more with these type of illnesses.
Why do you think the mental health problems caused by cannabis don't seem to get talked about much?
I think that probably relates to the fact that a lot of people, both adults and politicians and some medical people, perceive cannabis to be safe. You always hear about people say, well, I smoked it and I've been fine. Now, you're probably right in the sense that a lot of people who smoke cannabis do appear to be okay. But the problem is that there's been lots of studies looking at this, and it has been shown that if you've ever used cannabis when you're younger, then that does increase your risk of developing psychotic type symptoms or mental illness by about 40%. Now, it's not a lot, that, but when you think of it, if a lot of people smoke it, then it will increase the general mental illness amongst the community. So that's an important factor to remember. The other thing, obviously, there's a big push, and the government and policy holders are all more interested in hard drugs like heroin, because these are the drugs that cause crime, people shoplift, there's lots of crime related to that type of thing, whereas perhaps cannabis, people's perception is that it's not as dangerous or harmful to society. But I think generally now the perception of that is gradually changing, because reality is hitting home that people are getting quite unwell mentally with it. So I think that is why people's perception is not quite right there.
Thanks. Is it true that skunk is more likely to give you mental health problems than hash?
That's true. Now, as I mentioned earlier on, cannabis, there's a chemical in cannabis is called THC, or tetrahydrocannabinoid, and this binds to brain receptors. Now, in a normal reefer or little smoking of the herbal cannabis, the number of milligrams of THC is quite small, it can be less than 10 milligrams. But skunk is the stuff you hear about when people have got these bedrooms or flats with tin foil and lighting, growing these special, strong cannabis plants, and that's what skunk is. And the strength of cannabis, or THC chemical, in this amount of cannabis resin, which it usually is up to about 10 times or 30 times more, about 300 milligrams of cannabis, of THC chemical. And the evidence is that the more cannabis you smoke, the stronger it is, the more problems you're going to get. So if you're smoking skunk, which is much stronger, then there's much more chance you're going to develop mental illness, psychosis in the future.